I just wanted to say a couple of things about the claims backlog and then get to questions. As you know, and I think you said this in your prepared statement, the claims backlog remains a challenge to the VA. I continue to hear from New Mexico veterans about this problem. There's no doubt the VA must accelerate progress on this front, and I'm committed as a member of this committee to provide the necessary resources so that you can get the job done. I realize the backlog is down 40% from its high point a year ago, which means we still have a lot more work to do. Addressing the claims backlog is just one step, I think, in better serving our veterans. And now to my questions. I recently introduced a bill with Senator Heller of Nevada to improve care and access to care for rural veterans. One of the provisions in the Rural Veterans Improvement Act was to enhance mental health care for our rural veterans. After talking with veterans in places like Taos, New Mexico, and Roswell, New Mexico, it became clear to me that rural veterans who suffer from PTSD and other service-connected mental health issues are not always getting access to the care they deserve. This is concerning because veterans who do not access mental health care can be at higher risk of hurting themselves and others. Mr. Secretary, would you support initiatives such as the Rural Veterans Improvement Act to make fee-for-service available to veterans suffering from PTSD, traumatic brain injury, or other service-connected mental health issues under certain conditions where treatment at a clinic serving rural veterans is not available, or where treatment options such as complementary or alternative medicine, including traditional Native American healing methods, are not available?
Senator, I'm going to call on Dr. Petzel to provide some detail because some of what you've described, we in some measure are currently doing in some locations. So I just need to make sure that we understand and are responsive to your initiative here. You know, I would say we've had young people carrying the mission now for 10 years. These are great youngsters who have done so well. We're all proud of them. Mental health is something that we continue to focus on. As I've said, we've increased the budget here by 61% over the last 6 budget cycles. So it's something we work hard at. Rural issues are challenging, and we have tried some initiatives. Some of them seem to be bearing out. Let me call on Dr. Petzel here to respond to your question.
Thank you.
Senator Udall, you're absolutely right. There is a challenge in rural America to providing the services that these veterans have earned and deserve. What we do now is, number one, in all of our community-based outpatient clinics, we do provide mental health services. Either there's somebody providing there, or we pay for that service in the community, or we provide telehealth or telemental health connections. We do buy a substantial amount of mental health on our fee basis, in our fee basis program now with referrals. And we do telemental health actually in the home, where patients sit with their webcam and have a therapeutic episode with a psychiatrist at a remote area. Last year, 80,000 veterans participated in our telemental health efforts, and we expect that to increase substantially in 2014 and 2015. We'd like to work with you to see what the details are of the legislation, to see how it fits with what we're already doing. But we are committed, as I know you are, to getting mental health services into these rural areas, because there's very good evidence that when people come to us and we are able to treat them, they do get better.
Great. Thank you very much. And I think you all are realizing, like the medical profession overall is realizing, that telehealth and telemedicine is really a great opportunity for us to move out into these rural areas. Let me ask you, in terms of this budget, what do you do? Because one of the problems that I hear about visiting these clinics is the high turnover rate in rural VA clinics. What will this budget do in order to make that turnover not nearly as likely?
That is an excellent question, because you're quite correct. We have difficulty, Senator, in rural areas, as does everybody. This is not something that is unique to the VA. Our turnover rate generally across the system is much lower than you would see in the private sector. But in rural parts of the country, when particularly we're looking at physicians, physicians' assistants, advanced practice nurses, et cetera. The things that we have, or the tools we have available, are, number one, we have a lot of flexibility with salaries, and we do pay competitive salaries. Number two, it's an excellent place to have a career. There are all kinds of opportunities for advancement. We have recruitment and retention bonuses, and we're able to, or awards, and we're also able to forgive the educational debts that a number of these people have. So I think there are, within the budget, there is certainly the money, and there are the tools available that we need in order to make practicing in rural America an attractive proposition.
Thank you very much, and thank you for your good work, and I'll submit several questions to the record. Dr. Petzel, I had a call with you about Dr. Barnell and us
Right.
moving into a different status. I have a question on that and a couple of more. Thank you. Sorry for running over.